Okay, be sure you have your notes again, your lab handout. So we're going to look at what you would normally have gone through on the second day, covering the skull. On your sheet, your lab handout, on the front first page, we're going to look at all these things on the front page. We'll change pages, but the front page has most of it on there. So, look at the foramen of the anterior view of the skull. Now, this is in the middle of the left-hand side of that sheet. And so let's look at those. Foramen are holes. Foramen are holes in bones. And so wherever we have holes, they can be named, but they don't have to be hard. And so that's why I've got these foramen on the anterior part of the skull. We can look at the ones that are on the face, or the front part of your skull. And so the first ones that are above the orbit, they're called the supra, which means above, orbital, above the eye socket, which is the orbit, foramen, holes. So they're the holes above the orbits. Supraorbital foramen. Well, if these are called the supraorbital foramen, there must be some below, and there are. They're called the infraorbital foramen. Very easy to see. So it's the supraorbital foramen first, and the infraorbital foramen next. Now you look at the zygomatic bones, and you'll see 1 to 2 little small holes there. Those are the zygomatico-facial foramen. Remember, they're facial bones, and they're in the zygomatic bones, so they're called the zygomatico-facial foramen. And the last ones are in the mandible down here. These are in the chin. Mental means chin, and these are the mental foramen. The mental foramen. So it's real easy. They go right down the front of the face. Supraorbital foramen, infraorbital foramen, zygomatico-facial foramen, and mental foramen. All right, so that's just a real short little list that gives you all the foramen on the front of the skull that you're going to be held responsible for. Well, now we're going to look inside the cranial cavity, in the floor of the cranial cavity. So look at the top of your list, and it says foramen and the floor of the cranial cavity. And you see that there are 3 cavities or 3 fossa in here. Sometimes they call the cavity a fossa. And I have dashed lines across them, which divides them into 3 areas. Divides this cranial cavity into 3 cavities or 3 fossa. Now look at your list, and we're going to look at all the foramen in the anterior cranial cavity, or anterior cranial fossa. There's only 2. There's a single one here at the very front called the foramen cecum. Cecum means pouch or a little sac type structure, so this one's called the foramen cecum. So only one little hole. The next one, there's a whole bunch of them, and they're called the olfactory foramina. That means that's plural. And this part of the ethmoid bone is called the cribriform plate. So this bony plate here has a whole lot of foramen holes in it that are called the olfactory foramina. These are what your olfactory nerve sits on top of for your sense of smell. The little fibers go down through these olfactory foramina into your nasal cavity, and that's your sense of smell. So the anterior cranial fossa only has 2 holes, and it makes it real easy. You have 2, foramen cecum and olfactory foramina of the cribriform plate, the olfactory foramina. So when you go through the foramen in the cranial cavity here, the anterior only has 2, and that's it. And you study those by themselves and don't mix them with any of the other fossa. So you do the anterior first, got 2, and that's it, you're done. When we move to the middle, you see that there are 2 sets. There are 2 sets. We're going to do the one on the left first. And it's kind of, when I was learning this, my instructor told me, play like you're sitting here where I'm circling. This is called the hypophyseal fossa, but it's actually the middle of an area called the sella turcica, which interpreted means Turkish saddle. There's a raised portion here. This is the back of the saddle called the dorsum sella, we'll look at later. So if you're sitting in the saddle, your arms go through the optic canals, that's where your optic nerves would go through, to hold the reins of a horse. Let's say you're sitting in the saddle, your arms go through the optic canals, your legs are going to go down through these holes right here. They're called the foramen lacerum. To lacerate means to cut. These are jagged holes here. So the first set, you're sitting in the saddle, your arms go through the optic canals to hold the reins, and your legs go down through the foramen lacerum into the stirrups of the saddle. Optic canals, foramen lacerum, and that's that set. You're done with that first set of 2. Now there's a second set. The second set you see has 4, and you have to tilt the skull to look at the first one. It's underneath this wing. This is called the lesser wing of the sphenoid, and underneath it is a slit, but you can't see it from this view. You have to tilt the skull to look underneath that wing, and it's the superior orbital fissure. It's a slit in the orbit of the eye that goes kind of up and lateral, but there's a slit underneath here called the superior orbital fissure. A fissure is a slit. Next hole, you see there on both sides. The next one down is a round hole. Foramen rotundum. Rotundum means round, so it's a round hole. Foramen rotundum. The next one's an oval hole. Foramen ovale. So those 2 are named after their shapes. Foramen rotundum, round hole. Foramen ovale, oval hole. And then the last one's the little bitty one usually, called the foramen spinosum, and my instructor said like you got a porcupine spine and just poked a little hole there. Porcupine spine for spinosum. So the second set of the middle cranial fossa are the superior orbital fissure, foramen rotundum, foramen ovale, foramen spinosum, and you always do those in that order. It keeps them in order, and see they go in a line. Well, it's kind of a curved line, but still, they go in a line, 1, 2, 3, 4, and it's the same on both sides. So putting these foramen in short lists like I've done is a lot easier to remember if you do them in short lists, and you go through the list in the same order every time. You will not forget anything. Well, the last cranial fossa is the posterior cranial fossa, and there's only 4 in that set. Now this is a bony triangular wedge of bone here, and it has a little hole here. You have some nerves that go through there. It's called the internal auditory canal. Internal auditory canal. You drop down, there's a big hole here. Jugular foramen, that's where your jugular vein goes through. Jugular foramen. Look on the inside of this big hole here, on the inside wall. Hypoglossal canal. This your cranial nerve goes through there. Cranial nerve number 12, hypoglossal. So hypoglossal canal. And then the big one, the big hole here, foramen magnum. That means large hole. So internal auditory canal, jugular foramen, hypoglossal canal, foramen magnum. Now I picked out a few of the foramen where it says foramen in the inferior aspect of the skull. So when we look at the underside here, you don't have to know all the ones on that list. So mark the ones that I've got here. The incisive fossa right there in the front part of your hard palate is named after your front teeth, which are called incisors. So it's called incisive fossa. It's a little shallow spot there. Then you have In your palatine bone, there's a large hole and several small holes. The large one is the greater palatine foramen, and then you have usually about 2 or 3 smaller ones. You only see one on this picture. The lesser palatine foramen. They're named after the palatine bone, the large and the small foramen. Greater palatine foramen, lesser palatine foramen. These back here are called the carotid canals. The carotid artery goes in here and goes through this bony straw here and then empties into the cranial cavity to supply the brain with blood. So these are the carotid canals. And the last one is kind of hard to see on this picture. From this angle, there's a big bump here called the mastoid process, and you can see it right here. This big bump right here. And then the other one we're going to look at is this one right here called the styloid process. It comes to a point. So we're looking at these 2 bumps, but it's kind of hard to see on this 3-dimensional drawing here. Mastoid process, and here's the one that comes to a point, styloid process. And the foramen in between them is named after both of them, the stylomastoid foramen. So it was named after these processes, the styloid process and the mastoid process, stylomastoid foramen. So you have 5 out of that list of 12 that you need to look at from the underside. We have processes. So you need to look on the page 2, so from the back of page 1, the very top right, and you see that there are 6 processes around the zygomatic bone, and I have little happy faces there on either side. Now the processes are on either side of the suture. See, there's a suture between the temporal and the zygomatic. There's a suture between the frontal and the zygomatic, and there's a suture between the maxillary bones and the zygomatic. It's where they join together. Those are sutures. Now we're not learning the individual names for those sutures. You just have to accept the fact that that's a suture between those bones, and the processes are on either side of the suture line. That's where the processes are. All right. So let's look at the first set. 3 processes around the zygomatic bone. All right. First of all, this is the frontal bone, right? And you see that it has a process that's joining to the zygomatic. So that's the zygomatic process of this bone, of the frontal bone. The part that extends and joins to the zygomatic bone is the zygomatic process of this bone, of the frontal bone. Well, the temporal bone has one too. The temporal bone has a little arm that comes over here, and it's attaching to the zygomatic bone, so it's the zygomatic process of this bone, of the temporal bone. The maxillary bone has a pretty wide process that attaches or joins to the zygomatic. It's called the zygomatic process of the maxillary bone. So all these processes around the zygomatic have processes. The zygomatic process of this bone, of the frontal, the zygomatic process of this bone, the temporal bone, and the zygomatic process of this bone, the maxillary bone. And likewise, the zygomatic bone has 3 processes that join to those 3 bones around it. So here, this is the process of the zygomatic that joins to the frontal. So it's the frontal process of this bone, of the zygomatic bone. The process that joins to the temporal bone, temporal process of the zygomatic bone. And this wide process that joins to the maxillary bone is the maxillary process of the zygomatic bone. So it's very simple to get these down. It's a very simple process, and sometimes it starts off confusing, but go through this again and you'll see that it's really not that bad. It's really very, very logical procedure for getting these processes down. Look at the bottom of your page on the left-hand side, and you see the auditory ossicles. Ossicles means little bones, and auditory means hearing, the little bones of hearing. And these are the bones in your middle ear. And they are the malleus, which you heard about the hammer, anvil, and stirrup. Well, we have the correct names. The malleus is the one that's up against your tympanic membrane, your eardrum. So the malleus is this one, shaped like a mallet. The incus, you can't see the other part, but it looks like a tooth with two roots. This is the incus. So when the tympanic membrane vibrates, the vibrations transfer to the malleus, they're transferred to the incus, and then to the stapes, which does look like a stirrup. And that stapes is going to vibrate and sends shock impulses or wave fronts into your inner ear for hearing. So these are collectively, these three bones are called the auditory ossicles. Individually, malleus, incus, and stapes. And that's the end of this PowerPoint.